Meril is one of the fastest growing medtech company from India. It is present across 105 countries and subsidiaries in 22 countries. We are the company who have recently launched the Barbed Suture, which will be your partner for all your laparoscopic hysterectomy, myomectomy surgery. So let me introduce Pinion to you. So it's a Barbed Suture. It's composed of series of barbs. You can see the barbs here that are designed to grip on the tissue, create a secure anchor point for the suture by eliminating the need of knot tying. So we understood the problem of knot tying when you do the laparoscopic surgery. It takes a lot of time. So to minimize those time, we have come out with a suture which automatically grips with the tissue and there is no need for tying the knot. The next slide, please. So for all laparoscopic gynec procedures, even you can use it for open procedure as well to close the rectus sheath. Next slide, please. So this is Pinion, which is swift, which is facile and assured results. Next slide. It comes in absorbable monofilament in two groups, in polydioxanone, which gets absorbed in 180 days, and it comes with polyglycolic acid and polyglycapron, which get absorbed in 90 days of time. Next slide. So we have unidirectional barb as well as bidirectional. You can see the two needles at both the end. It is known as a bidirectional one, and the needle at one end, the loop, adjustable loop at the second end. So it's a unidirectional. So this is our design. What are the feature and benefit? So this is where the important role of Barbed suture comes. You see the filament of the suture and there is a cutting depth. It is known as a dual axis cut. And this is where Pinion separates from the current competition in the market, which is from V-Lock and Stratafix. So this is a dual axial cut, which is a patented cut with Meril Pinion suture only. So this is the position where it grabs with the tissue. So there is the better retention of the tissue. There is no loosening of the tissue. It doesn't go back once you have sutured. Next slide, please. So we have a welded loop design at the end. You have to take the first bite through the loop inside. And in the second point, you see the unidirectional and bidirectional barbs with a spiral placement. It comes with a 300 series very strong needle, and it is available in a low memory tray. So there is no memory of the suture as well. The next slide, please. So the key attribute is it is very swift. You can complete your procedure in 10-15 minutes. It's facile and it is very assured. It offers a better grasp of the tissue at numerous points to offer a secure fixation. The next slide, please. So these are the content of the Pinion suture. It comes with polyglycolic acid and polyglycapron, which is a midterm absorbable. And if you want to close the rectus sheath, it comes with the polydioxanone, which is 180 days. Both are in violet color. The next slide, please. So if you look at the differentiation of the angle, so one is from Stratafix, one is V-Lock. The degree of angle, the barb to barb angle is 40 degrees. The barb to barb angle comes at around 110, 118 degrees, which is also once again high. In 1 centimeter, there is 14 to 16 barbs. Compared to the competition, it's only 10 and 11. So more the barbs, better is the fixation. The secure fixation is there. So the wound closure, I'll briefly go through the wound closure. So the first step is that you take a backward split thickness bite at the end, and it should be around 45-degree angle. Then you exit the needle at the corner of the wound. Then again, you take a single forward split thickness bite at a 45-degree angle, and then you pass the needle through the loop of the end. Now you can go back once you continue do the suture at the end, at the last. The next slide, please. To close it, you take a perpendicular incision to exit the skin. I can show you one video where pin and barb suture is used. The myomectomy one. The second one, myomectomy. There's a V transfer file. Video gets open. Do you have any questions for me? How do you like the suture? Would it help for your, is it a solution for your lap hysterectomy? Yeah. Yes, sir. It comes in 15 centimeter, 30 centimeter, and 45 centimeter. The needle size is round body. It comes into 19 mm needle, 36 mm needle, and 45 mm needle. Today also I want to, yeah, okay. This is the use of a barb suture in one of the case. This is a barb suture. There is no need to tie the knot. It's almost done. So it makes your job easy, right? So any idea on the cost of this suture? Any idea on the cost of this suture? Barb suture? So I give you an introductory offer at KOGS. We will be offering this suture at 33,000 shillings for 12 oils. Only for KOGS, doctors who have attended here. Thank you.
Oh, yes, sorry, I had one question. Yeah, thank you for the presentation. My question goes out in relation to your comment on the barbs. There's been controversy in terms of the barbs causing injury to the other.
Yes. So that controversy was with the one of the company. Yes. I would not name the company because they have a spiral shaped barb and because of the spiral shape, there was an injury. Then in some cases there was some pain caused to the patient. I was aware of this. We have overcome that. So we have technically placed the barb in such a way that that pain is not there with our barb suture.
Yes, thank you very much. I think that's a very good presentation and a good invention for us. There's been a lot of advocacy in trying to spread, the use of laparoscopic surgery across the country. And there has been a lot of studies that have demonstrated one of the reasons why we've had slow uptake of laparoscopic surgery within our centers, and especially in the low and middle income communities, is actually the cost of the surgery. And so we are trying to come up with innovative interventions that see to it that we actually reduce the cost of the surgery, sort of try to have local solutions for our local problems. So if we are going to spend 33,000 for a suture, I'm not saying it's a bad idea. I think it's a very good idea. I've used it before. I think it's a very good technique for someone who is starting out in laparoscopy and they have a problem with making the knot and such things. It can actually make a very big improvement in terms of increasing your reducing the time of the surgery. But is it really going to improve the outcome of the surgery in as far as the cost is concerned for the patient? How many patients, considering that almost 57% of the doctors who practice in this country as gynecologists are actually in public hospitals, and we are trying to introduce, to improve the quality of service in laparoscopy in public hospitals. How are we going to, overcome that cost so that most of these doctors can actually be able to afford it?
So if you consider cost of one foil, it comes to around, I think you can use only one foil. It comes to around 2,800 shillings. So use of one foil. So the entire pack is 33,000. So one foil can cost around 2,800 shillings, which is comparatively less. Of course, there are now only 2 companies who are manufacturing barb suture. As soon as the usage will grow, the number of usage will grow, the demand grows, the supply is there, I think the cost in future will come down. Because to manufacture this suture, it takes a very advanced level technology machine. We have imported 5 German machines. One machine cost a big lakhs of US dollars. So to manufacture this suture is very difficult. It is not possible with each company. So when the demand grows, I think the cost will come down. And definitely, if it is a government organization, if we can participate in the tender, we can give a good price for the government hospital as well.
Prof. Juang will finish it off. Yes. Don't go there. Some Raffles good things are here.
A nice presentation, something new at least. Me, I'm not a laparoscopic surgeon, but I do a lot of this operating on these fibroids. Now you showed there's just a very small fibroid. Maybe you just need one suture and that's all. But what we see are huge fibroids sometimes. Yeah. Can you do the same if you have a deep base? Let's say, I think something like that. Huh? Yeah, you have a long length, but the base is very large. So how are you going to do it? And anyway, that's my question. Just go there and answer so that everybody hears it.
So of course, there are guidelines introduced where we can have a laparoscopic surgery and where we can have an open surgery. So if you're doing an open surgery, of course, you can use the normal sutures. So these sutures are beneficial for the laparoscopic surgery and young surgeons who find it difficult to tie the knots and also want to save some time for the doctors who are kind of busy and they want to fast finish the case. And of course, we have a 45 centimeter length of suture and 15 centimeter length of suture also available in barb. And it depends upon the indication whether you use a laparoscopic case or open surgery. In open surgery, I don't think so there is a new use of barb suture in that.
I can just see that if you have a large base, it's going to be a problem for whoever is going to suture that bit and close the
Okay.
cavity.
Okay.
Food for thought, that is a professorial question. And when the guru has spoken, nobody else can speak after it. Thank you so much, Dr. Bruce. That will bring us to the end of the plenary session.